Today, our topic today is avoiding Medicare schemes during fall open enrollment. Melinda Gardner is the Benefits Counseling Supervisor for the North Central Texas Area Agency on Aging. In addition to all the hats she wears in that position, she also supervises the benefits counselors, the volunteer benefits counselors, and works closely with the state to coordinate training for them. She is certified by the Texas Health Information Counseling and Advocacy Program here in Texas. It's called HICAP, as a specialist in providing information and referrals for Texans who are Medicare beneficiaries or who are 60 years of age or older. She works daily with older adults and their caregivers to help them understand Medicare, Social Security, and other benefits. She also assists the Better Business Bureau Education Foundation in educating individuals about fraud and scams. Having known Melinda for many years now, I can tell you that she has tireless energy and commitment. She knows a lot, and I have watched her work with clients and in presentation. She's very committed to her work. So Melinda, thank you again for joining us. And how about if you want to take over?
All right. Thank you, Xanda, and thank you, Minerva and WellMed, for allowing me to present today on Medicare schemes. I do want to explain a little bit about our agency. Xanda mentioned that we are HICAP certified, Health Information Counseling and Advocacy. That is the name of our SHIP program in Texas. So SHIP, which is the State Health Insurance Assistance Program, is a network of nationwide communities that help individuals understand Medicare and other government benefits. So then there is a number for SHIP, or you can go to shiphelp.org to find the local SHIP in your area. We also partner with the Texas Senior Medicare Patrol to help individuals understand Medicare fraud and abuse. And today we're going to talk about preventing Medicare fraud. As part of the North Central Texas Council of Governments, we are a program, the Area Agency on Aging of the Council of Governments, and I have been with the agency for almost 12 years, helping individuals understand these benefits, as well as for assisted living, nursing facility, community benefits. So we do have a lot of information that we can share. Our agency also has ombudsmen that work in the assisted living and nursing facilities to advocate for residents. And we offer evidence-based programs to help individuals with fall prevention, chronic disease, diabetes, self-management, and pain management. So those are just some of the programs that we offer, but we are open Monday through Friday. We serve 14 counties, and those are the counties surrounding Dallas and Tarrant. If you are in those areas and you have questions about our services, feel free to call. If you just have general questions about Medicare, you're still welcome to call our agency. But if you do need individualized assistance, it's important to contact your local SHIP because there may be programs in your area that we are not familiar with. All right, next slide, please.
The little delay I found today. For those of you who are joining us, I'm apparently the only one in the network that uses a Mac, and it has some specific challenges we have not. Well, we did it a while ago, there we go.
There we go. All right. So SHIPs can help people understand their costs and coverage. We can help with comparing plans, requesting enrollment or changing plans, and correct billing issues. Now, we don't correct billing issues, but we can kind of walk you through what needs to be done if there are some issues with any bills that you received in reference to your Medicare plan. Next slide, please. So as I mentioned, SHIPs are all across the United States. There are 54, including in Puerto Rico, Guam, DC, and the US Virgin Islands. That encompasses 22 local programs, over 12,000 counselors. That's a lot of counselors, and 4 million individuals who have been educated through 2.5 million counseling sessions. So, as I stated, all over across the United States, we're here to educate individuals on their options and Medicare programs. Next slide, please.
Back. You may have to just keep going, huh?
All
Folks,
right.
I'm doing the best I can. This is
You're
just.
fine. You're fine.
I
The
find that most people listen to these sessions are very forgiving.
Yes. Oh,
There we
okay.
go.
One more. Okay, there we go. All right, so today we're going to talk about preventing Medicare fraud. And we are a part of the Texas Senior Medicare Patrol. We're going to talk about scams of Medicare open enrollment, agent and broker rules, how to enroll, and safety tips. Next slide, please. So the Senior Medicare Patrol is also federally funded. There's one in every state. And we recruit and train volunteers and professionals about Medicare fraud and abuse. And then if there is something that needs to be done, if there's action that needs to be taken, that is referred to the Better Business Bureau Education Foundation out of Houston, Texas. And then they gather the information and report intentional fraud and abuse to the Medicare fraud control units. So our job as volunteers and professionals is to educate the community. There cannot be enough of that because scams are happening every day. Next slide, please. Medicare open enrollment. It can be overwhelming. And sometimes that's how people feel. It can be overwhelming because there are so many options, so much information that's provided. So it's important to seek help if you do have questions. Next slide, please. But know that you are in control. It's important that you review your Medicare Part D plans or your Medicare Advantage plans if you have one every year. You are awesome. And you want to make sure you understand what those options are. Plans change, and you want to make sure your prescriptions and doctors are still in your network. And so it is important to do your research and know what you're getting into. Next slide, please. Oops, I'm sorry. Yep. So we talk about the alphabet soup. We're going to give a little background on Medicare. Next slide. There are 4 parts of Medicare. Part A is hospital. Part B is medical. Part C is an option or an alternative, which is a Medicare Advantage plan like an HMO or PPO. And it includes the Part A benefits, the Part B benefits, and most of the time the Part D coverage or benefits. And then we have Part D, standalone prescription drug plan or drug coverage. Next slide, please. So during the Medicare open enrollment, which runs through October 15th through December 7th, that's the time when Medicare beneficiaries can join, switch, or drop a prescription drug plan or prescription drug coverage, whether that be through a standalone prescription drug plan or through a Medicare Advantage plan. Next slide. So if you do have questions on benefits or enrolling in a plan, if you can continue, you can contact 1-800-MEDICARE. You can go to medicare.gov. You can contact your local SHIP and review your Medicare and You handbook. There's a lot of good information in the Medicare and You handbook. And what we try to do is answer a beneficiary's question and also direct them to where they can find that information in the Medicare and You handbook, because that's something that they have handy all the time. Next slide, please. So now we're going to talk about scams of Medicare open enrollment. Next slide. Scammers lie. Can you believe that? Scammers will lie and try to represent themselves as government officials. These contact seniors by phone, by email, or by coming to their door, asking questions about their health insurance or offering them new cards to replace their current card. So they want to talk to them as if they are a friend. And that's to get you to believe that they're a good person in the intent, and the intent is to scam you. Next slide, please. So what are some of the common scams? Medicare or health plan calls and wants you to send you a new card for $299. How much did it cost you to get your Medicare card? Nothing. There's no charge for the Medicare card or an Advantage plan or a prescription drug plan card. So it does not cost anything. You receive a call about a refund from last year's premium or your drug plan costs. That's not going to happen. There are very few times where you receive a refund for last year's premium. Maybe you overpaid, but it's important to seek out that information from your plan, not from an email or a text that you may receive, or even a phone call. Call the plan from the number on the back of your card. Or an agent tries to sign you up for a plan that you don't need, isn't right for you, or doesn't even exist. How is that possible? They try, they lie. So it's important to look on the back, in the back of your Medicare and You handbook. If somebody's trying to sell you a plan over the phone, first of all, we always say, hang up. But if you start talking to someone and they provide you with information on a plan that sounds too good to be true, check your Medicare and You handbook. In the back of that book, it lists all the Medicare Advantage plans and the prescription drug plans, as well as the monthly cost for it. So if somebody's telling you a plan is, $5, I'm not aware of any plan that costs $5. So I'm going to check the back of my Medicare and You handbook, find that plan in the back of the book, and verify that that plan exists. And then I'm not going to sign up from that person that calls me on the phone. I will say, let me think about it. And then I will call the number in the Medicare and You handbook, because I know I'm calling the plan directly. Next slide, please.
There it is.
So what we want to do is watch out for those fake prescription cards offering big discounts with little or no benefits. We see some of those cards, and some of them will work. They will offer benefits that will lower your costs, but some of them are fake prescription cards. The next bullet says you receive a call offering big discounts on a new health insurance plan. They do not provide discounts. You pay what the plan has set as the monthly premium. And then this is a big one. No health care plan is allowed to cold call you. So they may say, oh, we're calling you in reference to another option. They cannot cold call you. That is not an option. And now, unless you have signed something giving them permission to call you. Next slide, please. Why? Why do they want our personal information? Next two bullets. These scammers might be collecting Medicare numbers that will be used to commit Medicare fraud or medical identity theft. That is the reason why they want our information. It's money to them. They are able to possibly order supplies or have someone else receive services, and they will get paid for that. So that's why they want the personal information. Next slide. So what are some of the rules that agents and brokers must follow? And this is something set by the Center for Medicare and Medicaid Services, CMS. Next slide. Plan sponsors and their representatives, including agents and brokers, must follow the guidelines when marketing to beneficiaries. Marketing is seen as equivalent to steering beneficiaries toward a plan. So there may be agents and brokers who conduct a presentation. They are supposed to provide general information. If they start talking about a specific plan, then they are marketing or steering individuals toward a certain plan, which is not what they're supposed to do. They're supposed to provide general information. Now, if you actually sign a paper, say they have a survey for you to do. If you sign a paper, you're giving them permission to call you. And at that point, they are able to talk to you about specific plans. Again, if someone talks to you about a plan, always do your research. Let them know, I'll think about it and get back to you, and then talk to a family member or someone to make sure you understand that particular plan that they're talking about. Next slide, please. This is a handout that does explain all the do's and don'ts for agents and brokers. We can either email or mail this to you. It does provide great information about what brokers and agents can and cannot do, what's prohibited and what's appropriate. And I would suggest always having this available, because sometimes you may find yourself in a situation, maybe at a senior center, and you're there for a presentation, and then all of a sudden, someone starts talking to you. It could be something prohibited. So if you understand what is prohibited and what is allowed, then you can respond better. Next slide, please.
And we should be able to email that to everyone.
Okay, great, wonderful. So on the next few slides, we're going to talk about some do's and don'ts. The prohibited will have an X, and the appropriate will have a check mark. Next slide. So agents and brokers cannot state that they are from Medicare or use words or symbols, including Medicare, in a misleading manner. For example, they cannot state that they are approved, endorsed, or authorized by Medicare, are calling on behalf of Medicare, or that Medicare asked them to call or see the beneficiary. So this is something that CMS is working on to try to reduce the practices that are happening, because our beneficiaries are suffering the consequences. So CMS is working on some measures to help reduce some of the practices. Next slide, please.
Come on.
Some of the other.
Go ahead.
No, go ahead.
No, I'm fine. We're
Okay.
good.
Some of the other prohibited behavior, they may not market to beneficiaries door to door, including leaving materials at a beneficiary's doorstep. That is prohibited. So if someone does receive something on their door and they have not asked for it, I suggest taking a picture and sending that to us so that we can provide it to the appropriate authorities, which would be the Senior Medicare Patrol. Also, if you have someone coming to your door and you did not request they come to your door, I would suggest getting a business card and sending that to us as well, because we want to try to eliminate fraud as much as possible, or eliminate this behavior as much as possible. And it's really impossible for Medicare to police the agents and brokers. There are over 4 million Medicare beneficiaries just in Texas alone. There are 62 million Medicare beneficiaries throughout the United States. So it's impossible for Medicare to police all the United States. So that's where we come in. And that's why we want to educate individuals to understand what is appropriate and what is prohibited. It won't advance.
Mhm. Come on, we were doing so well.
I know.
I had a chat come in, so come on. Is that
Okay.
it?
Next one. All right. Agents and brokers cannot send unsolicited text messages or leave voicemails. Again, if you are receiving this information, you can take a picture of it and send it to us so that, oops,
Sorry.
so that it can be addressed. Okay, thank you. Next slide. Okay, there we go. All right. Another prohibited behavior: may not approach beneficiaries unsolicited, as I stated, door to door. They should not be walking up to your car or approaching you in parking lots or supermarkets. We used to hear about people at HEB and Walmart approaching people about Medicare plans and prescription plans. That's prohibited. Again, getting their card, sending that to us, explaining what you witnessed so that we can identify what areas this is happening in. Next slide. All right, some other prohibited behavior: cannot conduct marketing or sales activities in healthcare settings except in common areas. There are some restricted areas such as the exam room, hospital patient rooms, dialysis centers, and pharmacy counter areas. I know we just had a flyer that goes out from a pharmacy, I won't even say the name. For each person that picks up a prescription, they get a flyer saying that they can contact this agency for information on Medicare plans. I'm not sure if that's a conflict of interest or not, but we did send that to the Texas Senior Medicare Patrol so they can look into it. Next slide, please. Unsolicited calls, including contacting beneficiaries under the guise of selling a non-Medicare Advantage or non-prescription drug plan product. If you're in a certain plan, then that plan can call you about that product. They cannot talk to you about another product unless you are giving them permission to do so. But it cannot be within the same call. It has to be something set up separately. Next slide. Cannot provide meals at marketing events or sales events. That's a big one because a lot of times I will go to events just so I can have the meal. And so since they cannot provide a meal, then they may not get the crowd that they're looking for. But providing a meal is not something that they can do. And sometimes what they may do is provide maybe a voucher for a meal. That is prohibited. They cannot do that. They can provide snacks and refreshments, but they cannot provide a meal. Next slide. They cannot conduct marketing or sales activities at an educational event, including distributing marketing materials or enrollment forms. This can be a little difficult because what they may do, again, is just provide their survey. So that survey, then you provide your name and address or your name and phone number. That's giving them permission to contact you. At that point, it's no longer an educational event when they call you. Now they can be in the sales mode. So be very aware that that's what they're doing. They are trying to sell, and that is the point of them contacting you. Some agents, now I've said it before, a few bad apples spoils the whole bunch. So you may buy a bag of apples. There's one in there that is bad. What happens? If it's in there long enough, it spoils the rest of them. So be very aware that just one bad apple, it may spoil the whole bunch. Because if you're not thinking, or if you're not aware, that it could be something that happened so quickly that you don't even realize it happened. So always be aware. Next slide, please. All right, so now we're going to give a few more items on the marketing rules for Medicare plans. Next slide. People representing Medicare plans aren't allowed to ask for your personal information, like your Medicare number, your Social Security number, your bank account, or your credit card numbers over the phone unless it's needed to verify membership, determine enrollment eligibility, or process an enrollment request. Plans don't need your personal information to give a quote. So that's another thing to keep in mind. You don't have to provide your personal information until you are ready to enroll. When you are asking for a quote, they do not need your Medicare number, your birth date. They may ask you for your birth date, but it's not needed to provide a quote. They may need to know whether you're over or under 65 in order to provide that quote, because it could be a little different if someone's under 65. But for the most part, in order to get a quote, for Advantage plans and prescription drug plans, the monthly premiums are the same. Unless you are subjected to a penalty, then it's different, but otherwise everyone pays the same. Next slide. People representing Medicare aren't allowed to offer you cash or gifts worth more than $15 to join their plan, or give you free meals during sales pitch for a Medicare health or drug plan. They have to offer everyone the same thing. So if they're offering gifts to one person, they have to offer gifts to all attendees. What happened in the past is they would offer gifts to those that actually enrolled, which that is not allowed. Next slide, please. They cannot ask you for payment over the phone or online. The plan must send you a bill. So if there are times when someone is asking you for your information over the phone, no, that is not allowed. They will send you a bill. Keep in mind that you may have to pay 2 months by the time that bill gets to you, but they should not be asking for your information over the phone, because then how do you know that it's going toward the right plan? So you want to make sure you receive that information in writing and that you're paying for the plan that you want to be enrolled in. Next slide. People representing Medicare plans aren't allowed to tell you that they're Medicare supplement insurance policies. So some people call Medicare Advantage plans supplements. They are not supplements. They do not supplement Medicare. They replace Medicare. Medigap policies supplement Medicare. So don't allow someone to tell you that Medicare Advantage plans are Medicare supplements. They are not. Next slide. People representing Medicare plans aren't allowed to sell you a non-health related product like annuity or life insurance during a sales pitch for a Medicare health or drug plan. Again, that has to be a separate conversation, and you have to give permission for them to do that. If you do not give permission, they should not be talking to you about that. Next slide. They're not allowed to make an appointment to tell you about their plan unless you agree. During the appointment, they can only try to sell you the product you agreed to hear about. Again, one product, you have to give them permission in order to discuss others, and that has to be a separate meeting. Next slide. Independent agents and brokers selling plans, they have to be licensed by the state, and the plan must tell the state which agents are selling their plans. So there is a licensing process. And if someone does have concerns about an agent or broker, again, the Texas Senior Medicare Patrol is available, or if you're in another state, you can contact the Senior Medicare Patrol in your state. If you go to smpresource.org, that's a national website, and you can find your local SMP on that website. If you have an issue with an agent or broker and you contact SMP, you can also contact the Texas Department of Insurance for those that live in Texas. They actually have the information as far as who's licensed by the state, and each state should have an agency that has that information. Next slide, please. All right, so the rules for meeting with an agent. If you're going to meet with an agent, they must follow the rules for Medicare plans and some specific rules for meeting with you. And what are those? Let's see. Next slide. During the meeting, Medicare plans and people who work with Medicare can give you plan materials. They can tell you about the plan options and how to get more plan information. They can give you an enrollment form. They can collect your completed enrollment form, and they can leave you with business cards for you to give to your family and friends. And that's as much as they're able to do, but they should not be talking to you about specific information unless you have given that permission. Next slide. And what they can't do is charge you a fee to process your enrollment into a plan. They cannot steer you into a particular plan. They must share all of the information, and they cannot communicate incorrectly with, back one, please. Yes. Nope.
There it is.
They cannot communicate incorrect information to you. And then if you sign up for a plan, then you're kind of stuck in that plan, but there are options for that. They can't ask you to give names and phone numbers or addresses so that they can sell to your friends or family. And they cannot ask you to sign the enrollment form before you're ready to join. Again, talking to your family or friends, talking it over with them as far as what you are signing up for and what plan you're going into. We always suggest checking with your current doctors if you don't want to change doctors to see which plans they accept and which ones are in the network. I would not suggest, if an agent or broker uses the internet to see if your doctor's in network, that's great. But I would suggest verifying with your doctor's office that they are in the plan's network. Next slide. You should only sign the form when you're ready to join. And again, I would suggest not joining on one phone call with someone, because you may not have heard everything that they said. Maybe they didn't provide all the information that you needed. So it's important to research, and make sure the plan you're selecting is the one that's right for you, not necessarily right for your family member or for your neighbor, but one that's right for you. Next slide. After the meeting, the plan will contact you to make sure you want to join and that you understand how the plan works. So this is a step in order to make sure that someone is joining a plan and that they have decided this is the plan they want in order to eliminate any possible fraud that may have happened. But if someone hasn't done their research, they may still enroll in a plan, but it may not be right for them. The agent who helped you join the plan can call you to talk about other plan options. That is permissible. But again, you don't have to sign up for anything else. You don't have to change. You can listen to the information provided. But again, talking it over with others will maybe help you understand it better. Next slide, please. So, how to stop fraud during open enrollment. That is a big, that's like the elephant in the room. It is almost impossible to stop it, but we can definitely reduce it by reporting anything that we think is fraud. Medicare will never call or visit. And we say never call, but they do set up those calls occasionally. But Medicare won't come to your door. There are 62 million Medicare beneficiaries. They are not coming to your door. Medicare will only send information via postal mail service or email. So it's important to guard your Medicare card and the number like it is a credit card. Would you give your credit card number to someone who shows up at your door? Would you give your credit card number to someone who has called you on the phone? No, because you don't want something being charged to your card that you are not going to receive. It's the same thing with your Medicare card. It is worth $30,000, but not to you, but to Medicare, to scammers. So it's important to guard that card. Don't give out your Medicare number except to your doctor or other providers. Next slide. Some other ways to stop fraud. Don't let someone push you into making a fast decision. Open enrollment is October 15th through December 7th. You can make a decision at 11:59 on December 7th, and it still will be effective January 1st. So don't let someone say that, oh, this is only good for today. That's not going to happen with Medicare plans. If you receive a call, especially from a number you do not recognize or anyone requesting personal information, hang up. You should not be giving personal information over the phone. And the last bullet says, know your healthcare options. Get help from your family, the Medicare website, or your local SHIP program in order to make informed decisions. Next slide. As we stated, Medicare will never call you. They will never come to your door. So it's important that you protect, detect, and report anything you suspect that could be fraud or abuse. It's not that it is fraud or abuse. It may be something that you suspect. Call. That's how we get ahead of the scammers, because any little tip will help us. There was a, I think it was a lady who had a charge of $9 on her Medicare summary notice. And she called the doctor's office and then she called Medicare. Once there was an investigation done, Medicare found out that this particular provider had this $9 charge, and it actually ended up being a duplicate charge. And it was it was a duplicate charge, and I can't remember what the service was, but the provider charged that to a thousand
Mhm.
clients. So how much is that? 9 times 1,000.
Mhm.
If it was 1,000 clients, that's $9,000
Mhm.
that provider was able to get for something that they did not do. So just that one phone call helped determine that this provider was charging additional amounts to some of their clients. So any small amount can help Medicare find these bad providers. So you can contact the Texas Senior Medicare Patrol at 888-341-6187 if you do want to report suspected fraud or potential fraud. Next slide. All right, so thank you very much for your time today. Again, my name is Melinda Gardner. I am a benefits counselor, and my contact information should be in your PowerPoint or PDF file that you received. We have a staff of 3 benefits counselors, and we have opportunity for anyone who wants to volunteer with us to also be trained to be a benefits counselor. You work either in your home taking phone calls, or we do have on-site clinics in some of our areas, and we're looking to expand those on-site clinics so that people can have face-to-face, which, people are used to that, and it helps people feel more comfortable. Thank you again, Xanda and Minerva,
Okay.
for this opportunity.
And let's open it up for some questions.
The next
One
slide
question.
has questions.
Yes, one question I have, Melinda, you referred to it a while ago, but we do have people, and you talked about people that might be in other states.
Mhm.
Could you please explain area agencies on aging and where else people should contact in their states?
All right, yes. If you're looking for the SHIP in your area, if you go to SHIP Help, and that's SHIP as in Peter, HELP as in Peter.org. That's the national website, and you can actually find the SHIP in your area in order to get questions answered about Medicare. We are each a local agency. We get funding from the federal and state government to help people understand what their options are and provide that education. So we don't steer people into a particular plan. We just provide options and make sure that we help you so that you can make an informed decision.
Can someone call 211 and be directed to a benefits counselor?
I say yes for our area. I'm not sure if 211, it should work the same in each area.
Right.
So if someone has questions about Medicare, then 211 should direct individuals to the local SHIP agency, yes.
And SHIPs are usually affiliated with area agencies on aging, or do they differ?
I believe in most areas, it is the area agency on aging, but some areas it may not be.
Okay.
Mhm.
And I have a question. You talked about they can't talk about additional products instead of specifically, would that be something like they start talking about a medication dispenser or start talking about an elder alert button? Is it that type of thing?
Well, that depends, because that could be a part of the Medicare Advantage plan benefits, because
Mhm.
the Medicare Advantage plans do offer additional benefits,
Right.
and that could be part of that benefit package.
But
But
they can't sell that product.
right, they cannot sell that separately, no.
Okay.
Good question.
Other questions. Minerva has put into chat the URL for, or the website for SHIP Help. And then I've also just posted call 211 across the US, when you call that number, ask for a benefits counselor, ask for SHIP, or ask for your local area agency on aging, because these are programs throughout the US. And benefits counseling is a required program for any area agency on aging. It's part of what their dollars have to be used for. Other questions? I don't see anything on the chat, but does anybody have questions?
I
you
had
would
a
like to
question.
ask? Go ahead.
I know about this every year. I'm just not too familiar with it yet. How often do you get that Medicare book? Is it just once you sign up, or do you get it every year with whatever changes have been made?
Every year, anyone on Medicare does receive a Medicare handbook. So each year it is updated, and the 2023 book came out at the end of September for Medicare beneficiaries. We do receive, or each SHIP should receive some Medicare and You handbooks. So if someone is new to Medicare or did not receive one, they can contact their local SHIP in order to get a copy. But it's important if someone did not receive a copy, to contact Medicare to continually receive a copy of it.
Thank you.
You're welcome.
Other questions?
And Zand, if we can go to the next slide.
Sure.
The Better Business Bureau Education Foundation.
I'm trying.
They receive funding from the Administration for Community Living, and just as we do, and they do ask that the survey be completed, just so they can see how well that I did in presenting their information. So if you if it's not pulled up, there it is.
There we go. There we go.
There. If you could use the QR code to take the survey. If for some reason you're not able to use it here today, then it should be included in your PDF file that you received. And if you could do that within the next couple of days, that would definitely help as far as the presentation, and to let them know if I did well or if I didn't.
And great. Melinda, if you would, for those who are not familiar with or not comfortable, how do they use that code?
All right, in order to use the QR code, you would just use your cell phone camera and put it over that code. And then it should pop up a window that can take you to a website, and it would be the Education Satisfaction Survey. It's as simple as that. If for some reason you are actually calling in by phone, then on your PDF file, you should still be able to do the same thing after this presentation.
Great. It's a lot of information, and we're still waiting for any questions to come in. When I get my Medicare book, I wish it came with Cliff Notes. Or, frequently asked questions. I mean, they do as well as they can to try to make it intelligible, but it can be a challenge. However, I'm just glad we get something. I would encourage any of you who have other questions. The SHIP website, Melinda gave you a couple of websites that you can call the benefits counselors. And again, benefits counselors are across the US. Call 211 and ask to talk with somebody about Medicare. Area agencies on aging do this. We haven't talked today about the ADRCs, Aging and Disability Resource Centers, but many people do that. They will call the ADRC, Aging and Disability Resource Center, which you can also access through 211.
Yes.
Through the program that we have for family caregivers, of which Teleconnection is part of it, and through Melinda's agency, we also have a website that many of you are familiar with. It's familycaregiversonline.net, and that's family caregivers plural online.net. And we have a whole section on frequently asked questions. We have a couple of blogs. Hopefully not too much information that will just confuse you. Again, you can tell by Melinda's conversation and presentation, she knows a lot about this. And the people that are out there across the country getting ready for Medicare enrollment, they do have some very rigorous training that they send them through. It is actually, they're certified to do this. That doesn't mean they know everything, but they know where to look and they know how to call. So if you have any questions or concerns, Melinda also has posted the Senior Medicare Patrol for that website. And then you have the 211, the SHIP help, and you all will receive probably the PDF. This was a very large PowerPoint presentation, and you probably will receive it via email in the PDF format. And anybody can open a PDF with any software you have. And we'll get with Melinda and get that do's and don'ts. It's in the presentation, but we can try to find one that's just a one page that will be helpful for you. Thank you so much, Melinda, again, sharing your time and expertise. She is extremely busy. She was promoted into a new job, so she has many more responsibilities, but she's gearing up for Medicare open enrollment. So would encourage you to take advantage right now of trying to do some research, all of you, and check into what you need. Many of you that have part of your Medicare might be an Advantage plan through a former employer. That's our case. Just write down some questions, do a little research online, and take a deep breath and realize it's important, but there is help out there to help you navigate this very challenging time during open enrollment. Thank you again, Melinda. Thank you again, Minerva Villarreal down in San Antonio, who is just always on top of all the technical aspects of all this. Would encourage all of you to join us for November or December's programs. We're going to be focusing on the unique challenges for caregivers during the holiday season. Thank you again, and we'll sign off now. Take care.
Thank you, Xanda. I was just about to post that in the
Great.
chat. So if you want to save that and send that out, that's the do's and
Okay,
don'ts.
the CMS.gov files. Okay, that's also in chat. Thank you.
Yes, thank you.